Yes, thank you, Bonnie. Yeah, honestly, guys, like the lifestyle is so important. Like, I cannot stress that enough. We have to get the lifestyle strategies in. Getting the lifestyle strategies in is what matters more so than anything else. Weight training, fasting, eating less processed foods, optimizing your stress, optimizing your sleep. This is what matters most. If you get those things in, you're going to have a better chance of long term success. Almost done here. All right, there we go. Okay, so fat mobilization. Guys, if you just hopped in the channel, welcome, welcome. So my name is Dr. Jones. I own clinics. We service across the nation, helping our patients achieve higher levels of health and lasting weight loss. We are always, and always have been, holistically rooted, but we embrace science. We embrace these medications. I truthfully think that these are the best tools that we've ever had long term. They are the closest things to a miracle solution that we've ever had, but they are not the miracle. The miracle is you. You are the potential to give miracle results. But I think we need help. I think we live in a society where we're so stressed out and exposed to toxicity that we need something powerful to help us. And that's why I think these medications are that the stimulus, they're the barrier smasher. And so let's use them, let's embrace them, but let's learn about what can you do long term. That's what we're chatting about, guys. And we're about to talk about fat mobilizing peptides here. Do me a favor, guys. I have no deadline this morning, so smash that like button. Let's see if we can get to 20,000 likes here in the next hour. Share this live with anybody that you think would benefit from this sort of content. I do have a ton of free resources that we're putting out every single day. If you guys are looking for coaching, if you're looking for support or guidance, please give us a text message. I do have my team working. If you click the X up there, you'll see the name that's going to pop up next to my, or the phone number that's going to pop up next to my name. With that number, you can shoot us your name and your email. They can get you scheduled. Yep, thank you. That phone number right there, guys. Shoot them a text message with your name and your email, and they'll get you set up for a free consultation. And they'll also give you access to a lot of the free resources that we were talking about. Okay, great. So fat mobilization. Hey, Amy, good morning from YouTube. Welcome, welcome. So fat mobilization is the prerequisite to fat loss, right? Before your body can burn fat, in order to get the fat for energy, it has to mobilize it. So when I look at fat loss and weight loss peptides and medications, I put them into two categories. We have our appetite suppressants and we have our fat mobilizers, right? So the appetite suppressants, semaglutide, tirzepatide, which are GLP-1s, and then you have tesofensine, which we talked about briefly. That's going to be the stimulus. That's going to be the trigger because at the end of the day, you can mobilize your fat all you want, but if you're not in a caloric deficit, you're not going to lose. So that's the prerequisite. That's the most important thing. So I always start with that first. Then, once you are in a caloric deficit, once you are losing weight, mobilizing the body fat is what is going to optimize the results. Mobilizing body fat stores is going to be what optimizes the results. And so, and what I mean by optimizing the results, Cheryl, can you hear me better now? Optimizing the results means losing less muscle mass and losing more fat mass. That's how we optimize our results. Because at the end of the day, guys, you have to maintain muscle mass in order for long-term success. There's a reason why you guys are seeing much more discussion about protein intake, muscle mass, protein intake. Everybody's talking about it. Huberman, Danica Patrick, everybody. We're talking about protein, muscle mass. And rightfully so. There's been a lot of good literature that's came out recently discussing how important muscle mass is. Guys, you will literally live longer, meaning die. You will less likely die from various ailments by simply having more muscle mass on your body. Even being an obese person, you are less affected by the fat on your body with having more muscle mass on your body. So dropping fat mass, you can say is or adding muscle mass, you can say is just as important as dropping fat mass. So adding muscle mass, adding lean muscle tissue is just as important as dropping body fat. Obviously, of course, we gotta do both. And aesthetically, we probably prefer to lose the weight and lose the fat, but I promise you, if you lose weight and you don't consume adequate protein, you're not lifting weights, you're going to become what we call a skinny fat person. And a skinny fat person is a situation that you don't want to be in because now your metabolism is slower. You will likely rebound and gain that weight. And then when you regain that body fat and you're back to that initial starting weight, you're worse off than you were before because your body fat percentage is higher than when you started. So you got to take this stuff seriously, guys. I can't stress that enough. Lift heavy weights, optimize, get your supplements in, you know, and this is what obviously why I'm a stickler for coaching. I think that it's crazy to think that you can jump into this new lifestyle and just get everything done right at first. Like it takes time. It takes time to get lifestyle. So that's why I do what I do. I think people need support. They need a community. We have thousands of people in my community where we're implementing these strategies, where we're implementing the flow protocol. What is the correct protein intake calculation? So I like to keep it simple. We optimize our protein intake. We strive between your current body weight and your target body weight, right? So if you weigh 200 pounds and your target weight is about 150, you should strive to consume between 150 and 200 grams of protein. I love it, Dawn. Train like a beast. Dawn has been kicking butt in my program. She's been very, very successful. And it really does start by getting the pieces in, getting all these various lifestyles in. Would switching from semaglutide or tirzepatide help with the plateau or maybe switch the injection site? So Tanya, potentially that could help, but you're not asking the right question. The question you should be asking is what caused the stall? And we talked about this earlier. The stall is likely a result of metabolic downregulation. The stall is likely a result of your metabolism slowing down in reaction to the calorie deficit over a long enough period of time. So if we have enough time, we can train on that again, or you can reach out to us for help. But there's absolutely switching the medications or increasing the dose that might give you short-term weight loss, but it's likely going to make the problem worse long-term. I'm a big fan of creatine. 5 grams of creatine in the morning. I think everybody should be on that. Research saying anything about 2 grams versus 1 gram per pound. Mark, I think 1 gram per pound of, of what I was saying is plenty. Anything more than that, I mean, if you're putting on massive amounts of muscle, I think 1 gram per pound is plenty. It's probably even more than we need, but I rather overshoot. Uh, so the way that you mobilize body fat is by adding, well, there's multiple ways. The most powerful way to mobilize body fat is with the peptides. So, beauty and life coach, we were talking about AOD, we were talking about CJC, ipamorelin, um, tesamorelin, samorelin. Those are all great fat mobilizing peptides. Mark, kidney function is something that I think about too, which is why I don't recommend 2 grams of protein per pound. That's a lot. You know what I mean? When you do it on an empty stomach, you should do it on an empty stomach. Most of these growth hormone secretagogues, you take them on an empty stomach. We have AOP troches, so you don't have to worry about injecting yourself every day. You take it in the morning on an empty stomach. You're welcome, buddy. You're welcome, beauty. Um, any high quality creatine is fine, guys. I'm a big fan of Pure Encapsulations. That's just my favorite company, not for everything, but you can text us and we can send you a link for our favorite supplements and a link where you can purchase if you want. Take what in the morning to help you with the stall? Um, there's nothing you can take that is going to fix the long-term stall problem. The weight loss stall is a result of metabolic downregulation. It's a survival mechanism triggered by a calorie deficit over a long enough period of time. Cassandra, you had that big of an improvement from creatine. That's awesome. I usually don't hear massive changes. People usually take creatine and they're like, I don't feel anything. But that's super cool. What did you notice when you started creatine? Guys, creatine monohydrate um, actually can improve your energy levels. It makes you stronger in the gym for more explosive type movements like weight training. It might even be neuroprotective. A lot of awesome things that creatine does. AOD, they do have injection form AOD, but I know how like um, annoying that is having to inject peptides every day. So we have oral troches, and oral troches are something that you pop between your gum and it dissolves. Should you take it in the morning or before you work out? AOD, I would take it morning fasted. Creatine is good for any age. Good morning, Chance. I haven't looked at the supplement Perfect Amino, but if I'm thinking of the one that you're talking about, I think it's just essential amino acids. I don't know how it tastes, but you can get essential amino acids for really cheap on Amazon, but they taste horrible. So usually the high quality essential amino acids products, good morning, Dan, are very expensive because they make them taste good, but you can get it 3 times as cheap, but it tastes like dirt. It tastes worse than dirt. Oh my gosh. I tried to take it the regular, unflavored, cheap bag and it's pretty brutal. So the companies that make it taste good, that's why it's so expensive. I don't think there's an ideal time for creatine in the morning, 5 grams every day, just to make it part of your morning routine. I think that's going to be plenty. Carrie lost 80 pounds using Manjaro. That's fantastic, Carrie. Good for you. Um, if you are starting to regain weight, guys, understand that this, first of all, understand that this is a very normal process. Maintaining weight loss is extremely challenging. On and off the meds, you guys have to understand that. Your body has a powerful weight set point. And when you lose weight with a powerful drug or a powerful peptide, you're going to have an even higher propensity to rebound, which is why I'm such a stickler for implementing aggressive lifestyle choices. To me, that's the end all be all. I don't want you guys to be stuck on meds for longer than you need to. I want you guys to be stuck on better lifestyle choices. And we can train on all of those. I have no deadline today, guys. Let me look at my schedule. Actually, I need to hop off. Oh, I got at least another hour and a half with you guys. So we're rolling, guys. We are rolling. Um, let's see. I gotta hop off by. I think I have an hour and a half at least, so that's good. Maybe even 2 hours. Is MOTS-C a good? Yeah, I love MOTS-C. MOTS-C is awesome. It's a mitochondrial peptide. It is actually they call it an exercise mimetic. Oh, Terry, you asked about AOD. So AOD is a fragment of the human growth hormone, specifically metabolizes body fat stores. So I think AOD is your best combo to pair with tirzepatide more long term. But if you can afford a cycle of MOTS-c for about 8 weeks is the most potent peptide that you can pair with tirzepatide because of what MOTS-c does. MOTS-c reduces inflammation, improves insulin resistance. It makes you more metabolically flexible by acting directly on the mitochondria. It's literally called an exercise mimetic because it is what your body does in reaction to metabolic stress, cellular stress, aka exercise. So you're literally releasing and causing the same reaction that exercise causes, which is awesome. When do you jump on the GLP-1 train? Jamie, you jump on the train whenever you're ready to ride that ride, baby. Like I don't know, the context of that question, but um, if you're struggling with weight issues, if you've tried and tried and tried, and your health is not optimal, um, then I think the GLP-1s are a tool that you should absolutely consider. But stick with me, join my community, and I'll help you do it right. I'll help you implement the best lifestyle choices. I think starting with intermittent 8-hour eating window that you do every single day, that should be a mandatory thing that you do for life. Compress your daily eating into 8 hours. There's no need to be eating beyond 8 hours. Then you start moving the needle and potentially getting into longer rounds of fasting. Uh, yeah, I see no issue, Pablo, and I've heard of no issue for diabetics taking creatine. Um, Dan the man, I love it. I love it. You're thinking. You're thinking. It's a tool, not a long term solution. So, what is the solution long term to counter the metabolic downregulation? Well, I taught you guys what it is. I taught you guys how to fix the plateau. Now, how do you prevent it? That's the thing that now we should talk about. So, in my protocol, which is the flow protocol, FLOA, fasting like our ancestors, I created the world's most aggressive prolonged fasting regimen. And so we get our patients up to the point where they do one weekly long fast beyond 24 hours every single week. So instead of trying to lose fat every single day, we're getting one long fast in per week and losing most of the week's fat, like the week's worth of fat loss in that one long fast. And that comes with a ton of benefit, right? Lowering insulin levels, lowering inflammation, all the benefits of prolonged fasting that you've read about. And then the rest of the week, we focus on high calories, high protein. There's some method to this madness, right? Because now we're hitting our body with high calorie signals. And if you remember what I said earlier, is metabolic downregulation. Low calorie signal, day in, day out, over and over and over. So if you counter the fasting with higher calorie signals, just from my observation, doing this with people for 20 years, you don't get as much people plateauing because your body never experiences a consistent caloric deficit. Does that make sense? Um, Thoughts on bone density loss while on GLP-1s. You will lose uh, bone density if you're losing muscle mass because muscle mass is what keeps your bones strong. Lifting weights is significantly stronger for mineralization of the bone than anything else. And so if you're not lifting weights, if you're losing muscle mass, your bones get weaker. Exactly, Rose. That's 100% correct. Jackie, I can't give you medical advice. You always should consult with your medical practitioner. But I think fasting is a phenomenal adjunct to any healthy lifestyle. How's IGF, LR3, and tesamorelin together? That's a lot, Amy. That's a lot of growth hormone optimization and insulin-like growth factor. Why you're trying to hit that pathway so hard. Barbara, please send me the list of your favorite supplements. Magnesium, um, vitamin D, essential fatty acids, and a broad spectrum multivitamin B complex, but make sure it's methylated. Those are my core four that every human being should be on. Guys, I'm gonna run to the restrooms. If you wanna just give me 30 seconds, I will be right back. I've been live since 6 in the morning, so I will be right back, guys. Alright. Oh, apparently some people left the live. Alright. Let's see. Um, Danny, would you keep taking Mot-C while fasting? Absolutely. Mot-C is amazing. Ideally, you do it for an 8-week cycle, 10 milligrams, once a week, and, depending on how metabolically broken you are, you can do up to 3 times a week for the first 2 weeks, and then once a week. That's what the literature looks yes, Kim, we focus on multiple pillars in my coaching program. So we talked about nutrition, we talked about fasting, we talked about exercise, specifically weightlifting, a good supplement protocol, inflammation, and then finally stress and sleep. I actually have a ton of powerful videos on YouTube that you can go find right now that pretty much tell you everything you need to do. I put as much information out there on YouTube as I can completely for free, but I still think my coaching program has tremendous value because now you're joining the community. Now you're joining the team. Now you have access to me to optimize, to customize, to tailor, to coach, right? To support you. And I have multiple different levels of coaching programs as well. Um, Now, what is the minimum BMI for tirzepatide? It doesn't really matter when you work with a clinic like us. We look at your metabolic health, but if you're talking about insurance companies, usually they want you to be at BMI 30, usually 28 to 30. Optimal, in my opinion, the most powerful 4 supplements that most people should be on: magnesium, essential fatty acids, which is fish oil, but you can get it from allergy too if you have a fish intolerance. Vitamin D in a good broad spectrum multi B complex, methylated ideally. And then it gets situational after that. Because if you have gut issues, if you have autoimmune diseases, then we got to get into some gut healing, some anti-inflammatory support. But we're just talking about the 4 supplements that I think would benefit the most amount of people. Those would be the core 4. Yeah, I know Dawn's been with us for some time and she's kicking butt. Um, yeah, Kim, good point. So I actually recommend 2 forms of magnesium, magnesium glycinate and magnesium threonate. I actually like, both. So you could do like 100, 150 milligrams of glycinate in the morning, and then you can do 100, 150 of threonate in the evening. The only thing that happens if you take a little bit too much magnesium is your stools will get a little bit softer, so you can back off and find that optimal dose. But I like threonate in the evening because magnesium threonate actually passes the blood-brain barrier. Blood-brain barrier is the driving factor for both diabetes, obesity, and overall poor mental health. Yeah, I don't like citrate as much. I like glycinate and threonate. Starting today, what's your best advice? My best advice I can give somebody starting is get honest and straight with yourself for 5 to 10 minutes. Sit down, pull out your notepad or pull out the notepad on your phone. Get away from distractions. Turn off your phone if you're writing, right? Or put it on airplane mode so nobody calls you. Figure out exactly why you're trying to do this. Why are you starting the medication? I want to lose weight. Okay, great. That's superficial. Get down to the deep, deep, deep nitty gritty. Why do you want to lose weight? And I promise you, when you do this experiment and you take it very seriously, you should feel some emotion bubble up. You need to get emotional. You need to get comfortable being uncomfortable. And then once you get down to that real why behind why you're trying to do this, the real motivator behind this, then you ask yourself some more questions. What's gonna happen in 5 years if you hit this goal? What's it gonna look like when you're feeling better, when you have more energy, when you're playing with your kids, when you're out there doing fun stuff? And then here's the toughest question that you might not wanna ask, but I want you to be tough, I want you to tough it out. What's gonna happen in 10 years if you don't do this? Like, really ask yourself this question. What's gonna happen in 10 years if you don't do this now? And I know some of you are not gonna like the answer. Some of you are going to get scared, and I want you to use that fear as a positive. I want you to flip that into motivation and say, "Holy shit, I need to do this now." That's the most powerful advice I can give anybody starting any sort of health optimization journey. Because then from there, the what you do, all that stuff, that's all secondary. None of that stuff matters if you don't have your freaking right, like frame of thought, you know? Somebody was asking about, PCOS. This is a game changer for PCOS. We work with a lot of PCOS, women. About 100 to 140, Betsy, milligrams of threonate in the evening closer to bedtime. Katie, I wanna run into less issues as I get older. Fantastic. That's fantastic. Tanya, Colorado Medical Solutions, but if you guys are looking to reach out to us, if you guys are looking for access to the free resources, or if you're looking to schedule yourself a free consultation, there is a number that you can text in order to reach out to us. If you guys see that X on the top right, click that X. It's going to zoom out. You're going to see the number to my clinic. With that number, um, TikTok doesn't allow me to say that. That's why I have to skirt around this for you guys. So that phone number that's attached to my name, shoot that number. If one of my moderators can pin that, um, shoot a text message with your name and your email. I do have people working on the other side of that line right now. and they can get you set up for a free consultation. Mark, that's exactly what I did, wanting to be there for your grandkids. That's awesome, Mark. I appreciate your support, man. I've seen you in my lives a lot. I didn't realize that you started off at 350. That's awesome, buddy. Keep it up, man. You're down 100 pounds in 8 months, man. You're close. I can smell it for you, buddy. That's awesome. I get acute pancreatitis on any dose. If you get acute pancreatitis, then you should not do these medications. Like, don't. It's not worth it. What I will tell you though is that you probably want to consider tesofensine. That's our favorite backup option for when you don't medically qualify for the tesofensine or for the GLP-1s. So it's called tesofensine. We're actually going to post a video today about tesofensine. Really awesome. Tesofensine just works on a completely different set of receptors. And so it doesn't have any of the same contraindications. So it's safe if you have pancreas issues or gallbladder issues or anything like that. That's awesome, Mark. 200 pounds is probably a good, I don't know how tall you are, but um, take your time with this last 50 pounds. Don't worry about those, like add some muscle mass. If you already lost 100 pounds, good Mark, adding some muscle mass if you haven't already is going to be necessary to get you there. Yeah, you're 5'11". I would definitely add some muscle mass. What about being diabetic with stage 3 kidney disease? You're going to have to work with your nephrologist and your diabetic providers. But I don't think any of them would disagree that improving your metabolic health is going to be a bad thing. I don't know what you're asking, A1. Does it work with normal weight people? I mean, this is a drug, and this drug is going to affect basically everybody. The question is how it affects them, and then the other question is why you're taking it. If you're at an optimal weight, you shouldn't be taking it. If you don't have fat to lose, you shouldn't be taking it. I don't really think I understand the question. What tips would you recommend for someone on tirzepatide that has had gallbladder removed? I would probably take bile salts for the rest of your life because you don't have a gallbladder, so you're not releasing as much bile. And so bile salts is sort of a substitute to a certain point for not having that the ability to release bile. Does it lower liver enzymes? It might. It's being studied for non-alcoholic fatty liver disease, and so yeah, many people get improved liver health from starting these medications. It's pretty awesome. Um, oh, Cheryl, is the volume still poor? Let me know if it's better. Yeah, Rose, that's awesome that you started bile salt. A lot of people, unfortunately, don't know about bile salt, but it makes a pretty big difference. Um, I'm about 50 pounds overweight. Is this good for me? Swim, I would say so. If you're 50 pounds overweight, then you have enough metabolic issue that I think this is a consideration. Um, because what we already know from the research is how negatively being 50 pounds overweight affects. Yeah, for PCOS, this is a game changer. This is a real game changer. I think it's got real promise um, for what we need to accomplish in that situation. Jerome, I can't give you that medical advice. I have seen some providers doing that. Doesn't make sense to me, but I think there are some individual nuanced reasons why they might want you to try that. You follow a certain diet, absolutely. The optimal diet on these meds is no different off the meds, guys. We need to eat less processed foods. The most powerful nutritional advice I can give anybody, even if you're at a healthy weight, to maintain a healthy weight. Eat less processed shit. Eat less processed crap. Like, I cannot stress that enough. Replace the processed foods with whole, natural, think fruits, vegetables, meats, legumes, nuts. That's it, guys. Like, the list isn't crazy long. Shopping at your grocery store and trying to eat food from the perimeter of your grocery store, depending on how your grocery store is set up, tends to be the most ideal approach. If you're looking to reach out to us, guys, there's a link on my homepage. But if you want to just shoot a text message, if you click the X right there, it should zoom out and you'll see my name there and my number. You can shoot a text message to that phone number, and then they're going to respond. They're working right now. They're going to get you set up on a free consultation. Jamie, yeah, that's awesome that you noticed that. Yeah, these medications are very, very life changing. Can hypothyroidism be reversed or improved? Potentially. It potentially can. It just depends on what's causing your hypothyroidism. Sometimes you will need to be on medication for life, sometimes you won't. That's a very nuanced question that takes a lot of digging into in order to figure out the answer. In people who have had gastric bypass use these meds, that's gonna be a question for your provider. Potentially, yes, but there's a lot to that question, so I couldn't advise you. Does taking a pre-workout drink in the morning bad? It's not that it's bad, Pebble, but honestly, if you're trying to get the benefit of fasting, I would stick to coffee with stevia because most pre-workout drinks are gonna spike some insulin because they have carbs, they have some sugar. Um, I have not been able to find a perfect pre-workout that meets the requirements of what we need to hit for this sort of lifestyle. Guys, this is the number right there where you can reach out to us. Shoot us a text message with your name, your email, and they'll get you set up for a free consultation. They'll get you access to all of the resources that we're talking about. What do you recommend for loose skin after losing 40 pounds with Ozempic? That's a tough one, user. You know, once you've already produced the loose skin, there's not a lot that can be done. I mean, there's some powerful peptides like GHK copper. There's some things you can do, certain local therapies, but honestly, if you're past the point of loose skin, surgery is going to be likely the only option for getting that tight look that you're probably hoping for. Um, but you certainly can try a lot of, I think fasting will help tighten skin. Collagen peptides, adequate protein, reducing inflammation, treating your body well, getting sleep, optimizing your stress. But yes, there's a threshold past which your skin is only going to tighten up with surgery. I think Athletic Greens is overpriced, but I think it's a great product. I think it's overpriced though. Uh, it's not a fiber product, that's for sure. It's more like a very fancy multivitamin, really good multivitamin, but I it's not. Um, yeah, so if all you're doing is intermittent fasting and you're not doing any long fasting, then taking Athletic Greens, you will lose some of that benefit. So if you can take Athletic Greens at the start of your eating window, that would be ideal. But once you start getting into long fasting, guys, if you're doing a 24-hour fast once a week or a 36-hour fast, once a week, which by the way, we only recommend that you do that often if you have fat to lose. If you're at your goal, 36-hour fast maybe twice a month is probably plenty. Well, actually, it's a lot, but this is what I think the key to maintaining a healthy weight is to rely and lean on more fasting, so you don't have to worry about burning so many calories. You don't have to worry about eating, not overeating. Fasting really gives you a ton of wiggle room. It also keeps you very insulin sensitive. So, um, can you take bile salts and a digestive enzyme supplement together? You can, user. I can't give you medical advice, but I've seen patients do that and they're fine. How do you feel about standard processed supplements? Um, I think they're definitely one of the better companies. I don't use them anymore. I have, other products that I'm a bigger fan of, but thank you, Leah. I think Standard Process, there's certainly many worse companies than Standard Process. Yeah, Jamie, one of the secrets to our success for our patients healing insulin resistance is getting them into a weekly long fast, sometimes even 48 every single week, which I know sounds wild and crazy, but that's why our results are so magical. Now, what makes the long fasting easier to do and adhere to is the combination of tirzepatide and fat mobilizing peptides. Type 1 diabetics, Luke, is kind of its own beast. You're gonna have to talk to your medical practitioner. We don't work with type 1s. Um, you should still take your vitamins, throughout your fasting window, absolutely. You don't want any micronutrient deficiencies. Yes, our women with PCOS do great with fasting, phenomenal results. You just gotta put it all together, guys. Um, weight training, fasting, eating less processed foods, these are the big 3. I have about 50 pounds to lose. Will this work for me? I mean, it might swim. I can't guarantee anything for you guys. The only thing I can guarantee in life is death and taxes. That's it. I can't I can't guarantee anything else. But, what I can guarantee, Swim, is if you join our community, if you become one of my warriors, I'm gonna do my best to help you kick ass, and I feel very confident we will get you there, but I'm gonna need you to do your part. I have a really awesome community where I'm coaching every single week. I have one-on-one, I have small group, I have large group, I have many different platforms to help you out with, but I'm gonna need you to do your part. Yeah, one time a week is great for a long fast, if you have body fat to lose. That's what my patients do. That's what we do with our patients. Um, yes, Rose, I work with medical practitioners in my clinic, so, I have we provide the prescriptions, they provide, for GLP-1s, for powerful, peptides, healing, musculoskeletal, neuropeptides, as well as the fat mobilizing peptides, and then we do BHRT as well, bioidentical hormone replacement therapy. Yeah, so I really feel like we have such a broad spectrum of powerful tools. We also like low dose naltrexone, by the way. If you have an autoimmune disease, if you're suffering with inflammation, from an autoimmune disease, I think low dose naltrexone has to be one of your tools. Absolutely has to be one of your tools because autoimmune disease sucks, and it does make it more challenging if you have an autoimmune disease. I'm physically located in Colorado. I actually live in Denver, but, we have clinics that service across the nation. So I lost the weight I wanted to lose, so should I discontinue it? Jazz, I can't give you that advice, but most people who simply lose the weight when they stop the med, they gain most of their weight back. So the question is, did you make the changes to your health? Did you make improvements to your health status so that you can slowly wean off the medication and maintain stability? If you decrease the medications and you start gaining weight back immediately or very rapidly, then you didn't make improvements in your health enough to stabilize. And so that's the magic of the coaching. User, I have a couple different brands I like. You can shoot us a text message at this phone number and we can send you a direct link to our favorite brand. I have a whole sheet for all of our people in our community where they can just purchase whatever supplements they like. Um, low dose naltrexone management from my company is pretty cheap. Uh, I think we charge like $50 a month for the management of it, 50 or 60, and then you pay for the prescription, which is like $40 a month, I think, or you can prepay for the whole year. So pretty affordable. But if you are in thyroid management or if you are in BHRT therapy with us, it's all included. Yes, we service California, user 636. Wherever you guys are located in the States, we got you covered. Everything we do is completely virtual, completely telemed. We got you covered. Um, Dan, seriously, when you can read the ingredients on your label, it's a good situation. B12 is great. Nothing magical about B12. It's not gonna hurt. It could maybe help. Yes. So the active ingredient in Wegovy and Ozempic is called semaglutide, and the active ingredient in Mounjaro and Zepbound is tirzepatide. Yes, we got you covered for Alabama. We got you covered in all 50 states. Guys, if you're looking for to get started, or if you're just curious about getting started, click the X right there by my name up here in the top right. It should zoom out, and you'll see a phone number. That's the phone number where you can reach out to us. Thank you so much for pinning that. Just shoot them a text message. I know they're getting a lot of calls right now, so I'd probably shoot them a text message and then give them your name and your email, and then they can respond to you with the booking link. Ben, I think carnivore is extremely difficult to adhere to. Um, if you can adhere to it, it's not going to be sustainable. But I know that sounds all negative, but it could be life changing for somebody who's having really bad gut issues. So I think that if you're going to use it, realize that it should be a short term tool. I don't think anybody should stay on carnivore for life. Although I have a lot of respect for Dr. Ken Berry. I have a tremendous amount of respect for him. And so that's why I always keep an open mind to carnivore. There's so many questions I have for him about the gut microbiome and what's happening to the gut microbiome when you don't eat fiber. I know that there's alterations, and so yeah, I just think it's challenging. Even if he can prove to me that it's very very ideal for your health to stay on carnivore for life, I know most people wouldn't be able to do it. So I think it's kind of a moot point to even have that conversation. The pricing for our peptides are going to match what you're going to see at most companies. Usually 200 to 300 a month for semaglutide, 300 to 500 for tirzepatide. Um, oh yeah, I actually follow Rob Cyrus too as well. He's also I have a lot of respect for him too as well. The carb addicted doc. I agree with most of what he says. Most of what he talks about, I'm in a line with. Um, Constipation has been killer. I would increase your magnesium dose. I would increase your magnesium dose big time. Trulicity is one of the earlier acting GLP-1s. I think Trulicity can be great. Any one of these GLP-1s uh, can be a potential solution for you. Um, because at the end of the day, it's going to be the lifestyle that's going to get you the results long term. Just think of all these as tools. Sometimes you have more powerful tools, sometimes you don't. But whatever support you can get your hands on, whatever help you can get your hands on, take it and run with it and do your best you can. If we use your services for thyroid, can you prescribe dose changes? Yes, Naomi, we can. We are bigger fans though of um, like a nature's thyroid or an NP thyroid, because we want you to get exposed to all forms of the thyroid T1, 2, 3, 4. And sometimes we do a compounded blend of 3 and 4. I like magnesium threonate in the evening and magnesium glycinate in the morning. That's the number, guys, that you can reach out to us. Shoot them a text message there with your name, your email, and they will get you set up with a free consultation. You can also ask them about any of the resources that we have here to help you guys out with. We have an awesome weight loss guide. We have an awesome Facebook community, a ton of resources. I lost faster on Wegovy, but Mounjaro has been slow and steady. I have no thyroid issue. That's great. That's great, Heaven. What kind of lifestyle interventions have you implemented? What kind of strategies have you implemented as far as your nutrition, your exercise, your sleep, your stress, your inflammation? What are you doing to improve your health on your end? What dose can I stay on to maintain? Samantha, I don't think that you should try to maintain. Um, as a long-term solution, I think that for a short-term solution, the lowest dose that allows you to maintain health. But I think you should always be challenging yourself when you're in that stage to figure out what additional lifestyle choices you can add so that maybe you don't need the med long term. I glad that you're tracking with that. This is a big deal. We have to get the lifestyle in. I can't stress that enough. Can collagen hurt your kidneys? No. I mean, I've never seen anything on that. GLP-1s have alleviated all my inflammatory conditions. GLP-1 medications are being studied as a treatment for autoimmune diseases, so it makes sense. Um, but I still think that you should be looking at lifestyle, changing your lifestyle to make more improvements so that you can possibly wean off at a later date. I like, yeah, exactly, Ben, thank you. About 100 to 200 for each of them. If you're taking a little bit too much magnesium, your stools will be a little thin, so you could just decrease the dose to find your optimal dose. But I do like extra magnesium when you're on these meds. Fantastic, heaven bound, that's awesome. Are you weight training? Are you hitting the weights? I call it beast mode training. Man or woman, you need to be lifting heavy weights. You need to put on muscle mass long term. Yeah, see, that's the problem right there, Heaven. Walking is not going to come close to what you need to do for metabolic health, especially as an autoimmune disease individual suffering with autoimmune disease. You need to add muscle mass to your body. Walking is not resistance. Jogging, even sprinting is phenomenal, but that doesn't replace weight training. You need to stimulate the muscles. Resistance bands, if done properly, could be a good solution. I don't know how you're structuring your protocol. Um, about 100 to 200 milligrams of magnesium for each blend. Yeah, Serena, if you're losing weight and you're not doing heavy resistance training, you will lose muscle mass. And the more muscle mass you lose, the greater likelihood that you're going to rebound. Weight training is non-negotiable. It's a mandatory thing if you want to be successful long term. It's just the reality of what these meds do. Is it the magnesium just for stool issues, or does it support oh my god, the magnesium is over 2 to 300 biochemical processes in the body need magnesium to drive. It's so much more than just muscle, firing. Um, it's so much more than electrolyte. It's insane how many things it does. The most important form of exercise, guys, is weight training, resistance training, hypertrophy. You need to train like you're trying to build muscle mass. That's the most important form of exercise. Thank you, Tanya. I'm really happy that you're finding this information helpful. I love doing this. Heaven bound, I hear you on the disc issues in your C spine and lumbar spine. That's obviously something that you're going to have to work with a physical therapist, um, a qualified personal trainer that can figure out how you can do resistance without hurting yourself. That makes sense. And so I don't, you're going to have to work within the severity of your injuries. Um, I like pure encapsulations. I like Magmine for the 3 and 8. If you guys want our links to purchase supplements that we prefer, you can shoot us a text message and they'll send you the links to purchase supplements. Pilates usually are not strong enough resistance to get the effect that we're talking about. Pilates are better than nothing, but they're not going to be enough to replace weight training. Thank you, babes. I do my best to drop it real. I do my best to be forthcoming and straightforward. I am the primary coach in my community, and so I have a lot of passion and enthusiasm. I've lost 100 pounds myself. I've struggled. I've been there with you guys. Guys, I lost 100 pounds when I was 16 years old, and it wasn't a clean process. I zigzagged and yo-yoed in my own personal weight for over a decade, losing and regaining and losing and regaining. So trust me when I say this, like, I wouldn't wish this upon my greatest enemy if I had enemies, like, it sucks. It's emotionally, physically, spiritually draining when you're constantly changing, when your weight's constantly moving. Having to always fit new clothes and never having same clothes too is also frustrating. So, providing stability for you guys in your health, providing stability for you guys with your weight is a very emotional thing for me because I've been there, done that. And as the leader of this community, I receive great joy in motivating you guys, for long-term success. Um, Thank you, Rose. Yeah, the honestly, guys, when it comes to weight training, uh, if you feel overwhelmed and you walk into a gym and you look around and you see all the individuals grunt. I don't know what gym you go to, but, if you feel overwhelmed in the gym, then I would strongly recommend you invest in a personal trainer. I know personal trainers are expensive, so you ask them for 5 to 10 sessions. Um, Thank you, it's magical, I really appreciate your feedback. But yeah, I mean, a couple $100 to get a personal trainer to teach you how to be comfortable around the gym, that's an investment that will pay dividends. It really will pay dividends for you long term. Yes, it would be awesome to have a trainer every time you work out, but that's expensive. So if you can make an investment for 5 to 10 sessions and they teach you how to be comfortable, they teach you how to work around injuries, they teach you a couple protocols to follow, they teach you what real muscular fatigue looks like. What does that burning sensation feel like in your chest as you press, right? Teaching you that you can push beyond the threshold of pain that you think is something that, shouldn't be pushed. That's what a personal trainer can teach you. I'll never listen to a chiropractor who thinks he's a pharmacologist. A pharmacologist isn't even a real thing, isn't even a real profession, so I'm just gonna laugh at that comment. Guys, I'm pretending to be a pharmacologist. I think she means pharmacist, which I'm not even pretending to be a pharmacist either. I'm not pretending to be anything. Oh, that's so funny. People are hilarious. Llama, there are trainers online. There are, yeah. And look, you can go to YouTube too as well. You can go to YouTube and you can find so many resources on YouTube, which I think are great. All right, Mark, you take care, buddy. Have a great day. Tracy bot. There goes my hopes and dreams of pharmacology. Exactly. Oh, that's funny. It's like going to the Oh, that's funny. I've been texting Will about full scripts. Danny, so Will is in back-to-back appointments. So, I apologize if he hasn't gotten back to you, but he's not the best person to text for that because he's in back-to-back appointments. The phone number that we have here that's attached to my name, give them a text message, and they'll send you anything that you need. That's my call center number. Take care, Mark. We'll see you later, buddy. Um, yep, there's the number right there, guys. If you shoot a text message to that phone number, they're going to be able to, answer all your questions. If you are in my coaching program, Danny, are you in my coaching program? Did you already sign up? Because if you signed up, you should have access to the Flow hotline too as well. I'm not sure if you signed up for the student or the warrior. Oh, babes, you have to have, like, the kind of patience. I just laugh at everything that these people say sometimes. Does Mounjaro give you the smelly burps? It may give you what they're referring to as sulfur burps, and so, taking a good broad spectrum digestive enzymes. Oh, yeah, that's true. That uh, I have, my girlfriend in here too as well, that's funny. Okay, I'm gonna call her B. That way I won't throw you off it. Um, user 823, um, do you have that number? If you've already talked to us before, yes, we do have some pretty awesome payment plans. Jonathan is like Will, he's back-to-back appointments, um, and so if you shoot a text message to that same number that I just pinned, they can get you set up, and, we can work out we have payment plans, we have different, lender options, and so we'll work with you to the best of our ability. Um, that's the number right there, guys, and so if you've already had a consultation with them, shoot this number and they'll get you reset up, they'll give you the booking link. Yes, we do have payment plan. Um, yeah, Danny, I wonder, what number you're reaching out to, but shoot him a text message right here, Danny. I do have my staff working and they'll respond. And you can also, if you just for extra measure, Danny, you can shoot me a DM on this page too as well. Just to double check, I just explain and we'll make sure that you get responded to and get taken care of. We do offer financing and various payment plans. Oh, B, that's great. That's great. Guys, if you have the medication already and you have the peptides, all you need is the coaching from us. So, yeah, that's awesome. That's awesome, and we'll work with you if you already have the meds and peptides. That's awesome, B. I'm super happy to hear that. Llama, I have my consultation with you guys soon. Thinking about switching. Fantastic, Llama. Super excited for you, and I can't wait to help you on your journey. How do you keep track when they run out of GLP-1 pharmacy every other week? We have a pretty awesome relationship with a few different compounding pharmacies, and so that's not gonna happen with us. But we're not trying to keep you on the meds long term anyways. Our goal is to help you, um, implement better lifestyle choices so that you can eventually wean off the medication. That's what we're looking to do with you long term. Can you use this medication if you have low blood sugar? I can't give you medical advice, Debbie. A medical provider is gonna have to make that final call. It should be fine, but I can't make that call. Ginger, yeah, peptides are amazing. I've done a lot of videos about peptide therapy. So peptides are kinda like nature's medications. I mean, honestly, that's the easiest way to think of them. They function like a hormone. So hormones are released in your body, they float around in the bloodstream, and they activate certain parts of your body to turn on a certain process, right? So peptides, you can think of them like that. You have peptides that turn on a certain activity, a certain function. For example, releasing growth hormone. So growth hormone releasing peptides are very, very popular. Yes, exactly. Um, in a literal sense, they're a short chain of amino acids, but they're powerful signaling molecules. Um, and there's many different categories, right? So my favorite peptides that I talk about are the fat mobilizing peptides to stack with your GLP-1s. Jesus, I think I've seen you before. You're in the right place. Um, I'll teach you as much as I can in my free lives, but obviously there's a level up. If you're ready to take this to the next level, if you're ready to do this right, if you want me to guide you, to coach you, to support you, to tailor this, that's where my coaching programs come into play. And so, uh, guys, I'm gonna be ending soon here. That if you click that X up there in the top right, my phone number is gonna pop up. That's how you can reach out to us. Shoot 'em a text with your name and your email, and they'll get you set up. How does it work switching semaglutide to Mounjaro? Generally, most people recommend starting back at the starter dose. I've been on for 7 months, 50 pounds down, and I'm stalling. Guys, that's the number to reach out to us. That's the best way to reach out to us. Shoot us a text with your name and your email, and we'll get you set up. We talked about weight loss stalls, Batista, so I'm out of time today, but you're definitely going to want to reach out for coaching so we can help you break that plateau. Um, Jody, I'm having horrible side effects from Ozempic. Can I take something else? Yes. So our favorite backup option, if you don't medically qualify for GLP-1s, is called tesofensine. So tesofensine is a completely different class of medication. It acts on completely different receptors. Tesofensine is a triple monoamine reuptake inhibitor. Essentially, the net effect is higher amounts of dopamine, serotonin, norepinephrine, causes some really good appetite suppression. It increases your metabolic rate. Um, yeah, that's a great backup option, and we can prescribe that to you as well. Yes, alternating injection sites for anything that you inject is a good idea. Should injection sites be changed each time? Yes. Um, Mrs. Me. So you have 100 more pounds to lose, and you're stuck in a stall. So, like I was telling Batista, we're out of time today to get into deep training about this topic, but just so you know, right, the, my girlfriend's so sweet. The quick answer of why you're stalled is due to metabolic downregulation. So you're losing weight over a period of time and your body stalls because it turns down the metabolism out of a literal starvation mode. And so you beat this, you fix this with a reset. A metabolic reset is essentially eating more over 3 to 5 weeks, and obviously there's a lot more to it. I'm rushing through this because I'm ending my live here in a couple minutes. What other areas other than the stomach? You can inject these, into any fat tissue on your body. What happens when you stop using the medication? Most people, Bill, will regain the weight that they lost when they stop. Not all, most. And I promise you, it's the things that I'm teaching you that will prevent you from being the ones that are regaining the weight. It's the lifestyle strategies that I'm teaching you, the alterations in your diet, the resistance training, the addressing inflammation, the better sleep, the better stress. All of these things matter to a certain degree, person by person. Unfortunately, though, most people are getting prescribed these medications. They don't have the coaching, they don't have the support, they don't have the guidance. It's like, "Here you go, increase it, after 4 weeks if you need to increase it, and that's it." And so people are just increasing the medication willy-nilly, and no one's looking at other reasons to support their weight loss. This happens most of the time. Jody Burke, you sound really familiar. Did we have a consultation a couple years ago? I'm sure you're a different Jody Burke, but there's a Jody Burke who I had a consultation in person in Denver, and you almost got started with us. I cannot remember if that's you or not. I mean, you tell me, you would remember meeting me. Bill, that's not what I said, Bill. I don't think you understood what I was saying, Bill. I'm saying that the reason why many people talk about taking this for life is because what most people are doing is not gonna address the basis of the weight maintenance resistance. What I'm saying is in order to address that so that you don't have to take it for life, so that you can maintain your weight loss, is you have to implement aggressive lifestyle choices. Aggressive lifestyle choices. That's what matters most. Yeah, so user, when you work with our clinic, you work with both my medical providers and me. So my medical providers are the ones that are gonna provide the prescriptions, they're gonna review your medical history, they're gonna do all that part, and then I'm gonna handle the coaching. That's how we handle this. It's a great divide and conquer. Yeah, I think we have to be aggressive. When you look at rates of obesity, when you look at rates of diabetes and metabolic health, um, I mean, it's staggering. Clearly, we don't know what the F we're doing when it comes to weight management and obesity management and diabetes management. Look how horrific the stats are. And so I do think that many factors contribute to this ever-growing rate of obesity and diabetes and poor metabolic health. I think toxic exposure is part of it. There's a lot of factors to it. And so I do think we need to be aggressive with our lifestyle. Um, why do you think it's okay to say a patient's name live? Who's saying a patient's name live? I'm only speaking about people's, TikTok usernames. I'm not sure what you're talking about. Um, yeah, Bill, I mean, this is the reality of the situation. So we gotta get that under control, and we'll help you with that. We will absolutely help you with that and get you, uh we'll help you get that under control. There's many other components to it, Bill, that are driving that hunger. And spoiler alert, it's mostly to do with chronically elevated insulin levels. Kimmy, the price is gonna vary dramatically whether you want one-on-one, small group, large group, and then we're gonna talk about peptides. We're gonna pair it with peptides, and usually we put it together in some package for you. So there's many different options, and they'll discuss all of that with you on your first call. Yeah, if you guys are looking to join, or at least you want to, schedule a free consultation and discuss your options, no pressure at all. You guys click that X up right there. There's a phone number that you'll see next to my name. Shoot them a text message there with your name and your email, and they'll add you to the system. They'll get you set up for a free consultation. Um, there's the number right there, guys. Shoot them a text message at this number, and they'll get you set up. People are funny. People are funny. Have always gotten chiropractors are like the redheaded stepchild, right? Like, we really are, you know, and chiropractors are always passionate about helping people in a holistic fashion. So like we talked about earlier, like, it's always been a big passion of mine. I've been in the weight loss space for 20 years, um, and, I see the reality of what's happening right now, and that's why I'm so passionate about doing what I do. But thank you guys for your support. She clearly didn't feel like having a conversation. Oh, man. Daphne, I'm on 15. I know I said I was gonna end. I am gonna hop off. I just wanna get all your guys' questions here before I hop off. Um, I'm on 15. Hunger is back. So, Daphne, you're on the maximum dose and your hunger is returning. That means you are developing resistance to the medication. And that's unfortunate that somebody had you get that high on your dose to begin with. We are very, very cautious about going that high. In many cases, we never go that high by medical practitioners because we implement so many other, lifestyle choices along with it. Do I prefer tricep over cell? What do you mean, Dan? What's SELG mean? Thank you, Ginger. Thank you, Linda. Oh, titrated. Okay. Yeah, Daphne, I think right now the problem is you're resistant to the medication. So, that's a whole other conversation. We're gonna have to resensitize you. Probably you're gonna have to take a break. Um, gotcha. I like the tripeptide. Dan, I think it works pretty great. User, you signed up for AOD. Fantastic, user. Oh, you're on my call tonight, this afternoon, the starter call. Super awesome user. Remind me on today that you saw me uh, this morning. Super excited to keep those calls very small. So, um, let's see. What are we doing right now? It's 9 o'clock already. Holy crap! It's 9 o'clock. What's the best way to wean off these medications? That is such a nuanced and complex question. I could talk for hours about to answer that question. The quick answer is as you're losing the weight, you have to fix the metabolic derangement. You have to fix the metabolic issues that would otherwise cause you to regain the weight when you get off the med. That's how you can wean off. Now, how do you do that? That's I think you do that with all the pillars that I've been training you on. Eating less processed foods, lowering your carbohydrate intake, lots of fasting, lifting heavy weights, addressing your inflammation, good supplement protocol, optimizing your stress, optimizing your sleep. The pillars. I'm not saying you have to get all of them perfectly, but at some point, the more that you do, eventually you're gonna hit a threshold where your body where it gets healthy enough and your metabolic health improves enough to where you are stable. And truthfully, after doing functional med for so many years and testing my patients on so many different things and trying to isolate, it's almost easier to just focus on trying to do those 8 things. Because I promise you, even if one of those pillars doesn't give you the result you're looking for at a particular symptom, I promise you it's helping you in some other area of your health that you don't notice. And maybe you'll never notice it. But I promise you, if you improve your sleep quality and you don't notice any changes, that improved sleep quality is an investment that you're making in your health. That's an investment that you're making in your body's health long term, even if you don't notice it. That's what functional medicine is all about. It's prevention. It's prevention of disease prevention. They help people beat the diseases too, but don't get me wrong, but functional medicine is all about lifestyle to maintain optimal health, which maintenance of optimal health means prevention of disease progression. And, it needs to become as routine as brushing your teeth, and it can become as routine as brushing your teeth over enough time. Nudgy, so you noticed a big improvement in your overall, health when you started sleeping and you started prioritizing your sleep, that's great. Yeah, it's obviously a lot easier to adhere to it when you notice the improvements, but, yeah, no, I'm super happy for you. My blood pressure, my weight, I know, and that's just one category. Look at she's sharing that just one category. I don't know if you did other categories, but, what's your take on insurance companies? My take is that insurance companies are the devil. Insurance companies, they suck, and they somehow get away with downright ridiculous things, and they make life hard for everybody, doctors and patients. If you guys saw that recent South Park episode, I think they did a really good job depicting how evil insurance companies can be. So, a lot of these insurance companies are fighting to pay for these medications, and I'm noticing that it's getting worse. Like, more and more companies are resisting to pay for these. What is your opinion about this medication related to depression? I think most people are noticing improvements in their cognitive status. I have seen some weird reactions though, otherwise. So, depression usually is a combination of many factors. We've had a lot of people get better by optimizing their testosterone levels, decreasing inflammation, improving key micronutrients like DHA, fatty acid. Those are big ones. Um, I would go see your doctor, Siluvi, because that's a weird thing to notice, and it's probably not connected, but I would rather you be safe. I will never understand how we let them have so much power. Oh my gosh, Trap. I think it's money, and money talks, and unfortunately, I'll leave it at that. Um, like I was saying, Laura, most people notice improvements in their overall, I would say their overall mental status, improvements in various mental issues, but I have seen some rare reports otherwise. So, hey, Carletta, um, if you are looking to get started on these peptides, on these GLP-1s, on these fat mobilizing peptides, or maybe you're interested in my coaching, there's an X right there on the top right. If you click that X, um, my name's gonna pop up with the number to the clinic. Shoot your name and your email to that, number, and my team will get you started. They'll get you into the system, and, they will, get you set up for a consultation. Um, Absolutely, Carletta. Super excited. Just so you know, I own the clinic. I have a phenomenal coaching program, and if you do sign up, you will see me in the coaching. I do one-on-one, I do small group, I do large group coaching. It just depends on how much access you want and the financials. You're welcome, Angelina. I love this. This is such a I'm blessed to say that I get to do what I really, really am lucky enough and fortunate enough to be able to do something and make a career out of something that also fuels me and fuels my passion. So I am blessed to say that. Um, who knows, Ashley? I don't know, you know? I will tell you this, that these medications are being studied for various medical conditions, addiction issues, autoimmune, issues, Alzheimer's. I think Alzheimer's and, neurodegenerative diseases are probably gonna be the 3rd category. Just FYI is my guess, but, chronic kidney disease, non-alcoholic fatty liver disease, so many different conditions. So, if it works, it's like, why wouldn't they, you know? Truthfully, one of the best things to do when if you are dealing with sleep apnea is to lose weight, but you won't lose weight if you don't wear the CPAP if you have sleep apnea because you need oxygen and you're not getting enough oxygen. So, as much as the CPAP device sucks, I would absolutely wear that if you do have sleep apnea, and use that as motivation to freaking lose weight and get your health in order so that you can reverse it and get off of it. Laura, this is the dark side to too high of a medication dose. If it suppresses your appetite so much that you can't eat, that's a problem. Like, that's a problem. You have to be getting enough nutrients. You have to be getting enough micronutrients, enough calories, and so you may wanna talk to your provider to potentially alter the dose, so that it's more suitable for you to eat and meet your nutrient requirements. Heartburn is can be complex. From a functional perspective, Supporting digestion is usually the best things you can do. Specifically, there's some uh, acidic support to the stomach that you can provide. And usually, when you do that, because usually heartburn is your body trying to make more acid because it's not acidic enough. They make baked bentane HCl, so you can provide some hydrochloric acid to your stomach when you're eating. And usually, what ends up happening is you take that with your meals. You take broad spectrum digestive enzymes, some anti-inflammatories, some glutamine, some gut healing supplements. Usually, that does wonders for not just heartburn, but overall GI issues. And proton pump inhibitors, unfortunately, are not addressing the cause of the heartburn. They're just addressing the symptom of the heartburn itself by making it even less acidic, which is obviously a problem long term. Yeah, apple cider vinegar is great. It not only provides digestive enzymes, but it also lowers blood sugar too as well. Aloe vera is great too as well. Yeah, there's a lot of good natural compounds out there, guys, which is really, really cool. Guys, this is the number here to reach out to my clinic. They can get you set up for a free consultation. They can give you access to a lot of the free resources as well. Just shoot them a text with your name and your number, and they'll get you set up. Yeah, Letty. So hopefully you learned a little bit about what you can do, and maybe you want to join our coaching so that we can guide you, and not only to beat the heartburn, but more importantly, improve your success long term. Um, so we were talking about heartburn, specifically supporting digestion. And so specifically, bentane HCl is going to provide more acidity to your stomach when you're digesting food, which is the reason why heartburn a lot of times is coming from is your body trying to produce more acidity. And so supporting the acidity of providing more acid in that hypochlorhydric environment alongside improving digestion too as well. So digestive enzymes, glutamine, um, anti-inflammatories like curcumin and resveratrol can all make a difference. Um, how do I get my doctor switch me from sema-based meds, tirzepatide-based meds? You just have to have a conversation with your doctor, Luna, um, or you find a new clinic. Oh, that's awesome, Dan. Oh, that's great that it helped you that much. Um, so if you're dealing with an autoimmune disease, PCOS, menopause, some more severe inflammatory conditions, then I like things that are more aggressive, like low dose naltrexone. Low dose naltrexone is the most powerful anti-inflammatory support that I know of for somebody who's dealing with any sort of inflammatory autoimmune condition. After that, I like uh, curcumin and resveratrol. Curcumin and resveratrol is also very, very powerful as well. Does it have a risk for blood clots? Does what have a risk for blood clots? These GLP-1s? No, they don't. Where do you get these at, or do they have to be prescribed? Yeah, GLP-1 medications need to be prescribed. So if you work with us, we're gonna do a comprehensive blood panel. We're gonna check your thyroid because if you're trying to lose weight, these medications won't override a hypothyroid situation. So we will check your thyroid, we will check your inflammatory markers, and then my medical providers, if warranted, will prescribe these medications, and then we have other options. We look at the big picture, and then the coaching. The coaching makes a big deal too as well. Hey, Blondie, welcome back. I think I remember you a couple times now. Is 13 pounds in 2 months healthy weight loss? I have no idea about your starting weight, Laura. So 13 pounds over 8 weeks, a little bit less than 2 pounds a week. It's very different if you started off at 150 versus starting off at 300. Um, Shelly, so we, uh, we do provide recordings in the Facebook group. We're gonna be migrating to a whole new community very soon. But, I am live almost every morning and some evenings as well. Um, I think creatine should be part of everybody's normal supplement routine. It's so cheap, it's so safe, it might even make you smarter. We don't know that for sure, but it definitely will give you more energy, for your weight training sessions, more strength, might improve energy levels. A lot of good things that creatine monohydrate does. 5 grams of creatine monohydrate in the morning. Yes. So our medical practitioners, if you are hypothyroid and we think medication makes sense, they will prescribe usually more of an NP or a Armour thyroid, possibly a compounded thyroid med as well. You started at 156, then I would say the weight you're losing is a good rate. I like it. Uh, are you weight training? Right? That's the big one. That's the big one. You're losing weight. Are you lifting heavy weights? Are you consuming adequate protein? Are you addressing the pillars that we've been talking about? The pillars of optimal health. They are so, so important. Mm, Courtney, first injection at 0.25. I haven't felt anything yet. I'm eating healthy, but I'm starving. Is that normal? Well, it's your first week, and usually they recommend 4 weeks at the starter dose, and you may not feel the starter dose. So it's important to understand that you need to work up. Your practitioner is gonna work you up to eventually hit that first critical dose, which is the dose when you start losing weight. But you shouldn't be waiting for the medication to trigger weight loss. You should be making dietary changes, adding some resistance training, optimizing stress and sleep, adding supplements. I feel like a robot repeating the same things here, but you guys get me. Yes. So nutrition, which is eating less processed foods, lowering carbohydrate intake, lots of fasting, lots of heavy weightlifting, addressing inflammation, a good supplement protocol, optimizing stress, optimizing sleep, so these are foundations, and that's why I call them the pillars of lasting weight loss. Candace, I haven't seen any issues regarding creatine and blood pressure medication, so you can always talk to your primary care provider. I can't give you medical advice. I strongly believe there's no interaction, no issue. What to do to help inflammation? So, if you have, uh, an autoimmune disease or some sort of inflammatory condition, I think low dose naltrexone is very, very important. I think it's a powerful tool that needs to be utilized. And then outside of low dose naltrexone, we can look at things like curcumin and resveratrol. Curcumin and resveratrol is probably the most potent anti-inflammatory supplement regimen. Yeah, absolutely. A lot of our patients do that as well. I mean, a lot of our patients are fully optimized and embracing these options. LDN, tirzepatide, fat mobilizing agents like AOD, possibly getting their hormones optimized, and then they're implementing these pillars. And that's why the results are so dang good.
Um, you gotta be careful with that. Um, it's a tough one because trying to catch up can create issues. You know, it's a very hit or miss thing, so I can't give you medical advice there. Probably safest to wait till your next injection day and get back to a rhythm. Hey, Tracy. All right, guys. I'm gonna hop off for now. It was awesome. I love it when these lives go much longer. I think we were on for 3 hours today. So, um, yes, I love AOD paired tirzepatide. Phenomenal, phenomenal combination. That's our favorite combination. Guys, before I hop off, this is the phone number. Please save that. Shoot us a text message with your name and your email. We will get you set up for a free consultation. We'll set you up with all the free resources. Um, we're going to help you to the best of our ability, and I would love an opportunity to coach you guys and get you guys the results you're looking for. We will see you guys later. Um, maybe tonight, tomorrow morning. Absolutely. I'm glad you guys liked it. Have a great day, guys.